Number 2, virus reservoirs and vectors, Dr. David Lakey.
Well, good afternoon, and again, would like to thank my group for a very robust, thoughtful discussion today, and also Dr. Weaver, Dr. Scott, Dr. Higgs for their expert advice as we went through this issue. I think I came to the realization we don't really understand this virus to the level that we really need to. A lot of discussion related to basic understanding of the biology of this virus. What are the potential vectors? What different types of mosquitoes could potentially carry this virus? And also an understanding of what are the potential reservoirs for this virus. And the need to understand that both in what's going on in Central America, South America, but also what are the potential reservoirs here in the United States. There was a lot of discussion about the role of asymptomatic infection. What role does the asymptomatic infection play to the spread of this virus? We also had a significant discussion about the environment and the role of the environment both on the vector and where the mosquito will travel, but also the role that temperature has on the replication of a virus within a mosquito. And so the environment can play multiple roles, and getting a better understanding of that we believe is important. We had significant discussion related to new technology and the need to look at the new technologies that look at different modes of action. And that these are being developed, but we really need to do that thoughtfully and make sure that there's a development part of this, but an evaluation to make sure that we look at these new technologies the best way that we can. As was noted in the previous discussion, we believe that we need to better understand the role of human sexual transmission. That obviously that is a hot issue. There will be a lot of discussion related to that, and we really don't understand that to the level that we need to. One of the things that we believe, and it's a little bit in vector control, but also kind of public health and general public health, is that the need to get out in front of this as much as we can related to education of the general population related to vector control, and discussion of, and again, not necessarily in our area, but the issue that we need to discuss this with physicians and get that health information out to physicians as quickly as we can. We don't understand the role of vertical transmission, how it's spread from one mosquito to another mosquito. It was brought up that this is very important in mathematically modeling this virus and the spread, and we don't understand that to the level we need. There was discussion about some of the basic infrastructure we need in order to respond, and for this evaluation, basic laboratory capacity, and how are we going to detect the virus once it hits our southern border or other places. There's a limited diagnostic capacity in the public health system right now for Zika, and that will be a major challenge for us in the response. And we need to train additional researchers to be able to be part of this ongoing analysis. Like the previous discussion, that lead to shared data so that we can work together on the response. And in that overall response, how do we govern it and what is the proper role to make sure that we are moving forward. There's a lot of discussion related to the potential for other arboviruses to move into the urban cycle. Discussion earlier today about the 200 different arboviruses, and so which of those could potentially cause disease, what's next on the horizon related to infectious diseases, and the need for just basic research so that we understand these viruses to the level that we need. And that's sort of discussion. Thank you.
Thank you. Are there any points of clarification for a minute that anyone wants to make? Okay.